All right, welcome everyone to the Power Hour for today, July 14th. We are going to have special guests today in the form of Josh Kondik from Home Care Pulse. Just a couple logistical items before we get rolling. Everyone, when they enter the room, is on mute. You should be able to unmute yourself if there comes a time you want to ask a question by audio. But we also have a chat functionality inside of Zoom as well. So feel free at any time to throw questions into the chat. We can get those answered for you. And again, if you'd rather ask it off mute as well, then we can make sure that we allow you to get off mute and ask those questions. So my name is Chris Tremp. I'm the COO for SwiftOps. Looking forward to hearing the information that Josh is going to share with us today. Home Care Pulse is fully integrated with SwiftOps. So we have the survey side as well as their e-learning side, all integrated in. If you don't know about that or you want more information about that, obviously check the knowledge base for Home Care Pulse. You'll be able to see the information there and be able to send your info over to Josh and his team for them to reach out to you to be able to take advantage of the integration. But if not, you can always reach out to support. We'd be happy to answer that as well. But a really nice integration partner. Looking forward to it. And I'm going to hand it over to Josh.
Great. Thanks, Chris. Can you hear me okay?
Yes, perfect.
All right. Well, hello, everybody. Thanks for joining today. We're really excited about presenting the findings today from our 2022 benchmarking report. For those of you that aren't familiar, Home Care Pulse has been operating in this industry for about 12 years now. And every year we do an annual benchmarking report. In that report, we survey not only Home Care Pulse customers, but also just the broader industry in general. It's really a key staple in home care. The report itself provides 7 different areas of business operations focus, over 175 different data points. The benchmarking report in and of itself is actually about 250 pages long. It's chock full of great data to help you determine, data comparisons between your organization, geographic region, revenue range, population served, and number of years in business. It also gives historical industry trends and comparisons. So that report, we do it every year. If you haven't participated in the past, great opportunity to share your data with where your organization's at, and then access the report afterwards to see how things are stacking up. But you can also access this report from the Home Care Pulse website at homecarepulse.com/benchmarking at any time throughout the year as well. So today we're going to cover some of the data elements from our benchmarking report and share those findings with you here. We'll look at a couple of different topics, including industry threats, recruitment and retention, training, revenue and growth rates, and what's next for the industry as well. And so as a business, I think across every industry, there's been this big focus over the past 10 years on the buzzword of big data. And I think we're actually starting to see that change a bit and not be so focused on what I would kind of call big data, but rather on really pointed, targeted approaches to data. And so the types of data that you should be focusing on and asking yourself questions around, particularly in home care, are, when should I hire a marketer? How much should I be paying my office staff? What are the top performing recruitment sources? What are agencies making 5 million plus in annual revenue doing differently than our agency? And things like, is a 72% annual caregiver turnover rate normal? And what should I be charging my clients if I live in a specific state or region? All of those types of data points can be extrapolated from our benchmarking report to provide key insights to your business. And so let's dive in to some of the data points here. And by all means, if you have questions along the way, please chat them in. Feel free to unmute. It's a fairly small group here. We've got about 15 people. So, I think there's ample time for us to answer questions as we go if there's something you'd like us to focus on. But let's look at industry threats. So As we look at what's threatening the home care industry, probably no surprise to anybody here, but the caregiver shortage and turnover remain top threats in the industry. We'll likely see rising business expenses climb after the high inflation year. So that's, the number fifth element there, business expenses rising. I anticipate that over the next year, when we do this reporting again in 2023, we'll see that number creep up. And so, as an organization, if you can figure out strategies to address these concerns and mitigate the risks associated with them, you'll certainly be more successful than others in this industry at this current time. And taking a specific look at recruitment and retention, let's just take a look at how the caregiver shortage has impacted businesses over the past 3 years. And so first, I want you to look at that orange bar, which is 2019. And you'll notice in 2019, kind of a standard bell curve as far as impact of shortages. But since then, we've seen that issue grow more pervasively impactful to the industry. And so it's moved from being a standard bell curve to being, negatively skewed, where most organizations, if you just look in 2021 and you look at extremely very negative and somewhat negative impact of the caregiver shortage, you've got about 90% of the industry saying that that is a significant issue or worry for their business. So I don't think that that's anything surprising with where we are in this space, but it does lend itself to informing us that, hey, things aren't going to get better right now. We need to figure out strategies on how to retain the caregiver.
Oh, Josh, it looks like we lost your audio there.
Can you hear me now?
Now we can hear you.
Where did I cut out at?
Just literally 20 seconds ago.
Oh, okay. I think if I'm repeating this and everybody heard me, I apologize. But basically, businesses, as an agency owner, we need to focus really critically on how do we retain the staff that we have today, and what are some different things that we can do in the industry for recruiting new caregivers, whether it's increasing pay or changing benefits packages or using different recruitment sources. Those are things that we need to think about as well. And so another thing that we look at is the different recruitment sources for caregivers, right? And so when we look at those recruitment sources, Indeed is by far the number one recruitment source. What's more surprising is we're seeing decreases in employee referral programs, word of mouth, and social media. So that's quite surprising, and I'll share why here in a couple minutes. But to say the least, there are some tailwinds that we're seeing as users are being reactivated. If you look at just that yellow bar there, reactivation of previously employed caregivers, that's increased about 50% over the past year. And so, an early indicator of something is that caregivers are re-entering the labor force. They're coming back. There's some growth there. So if you're not already targeting previous employees, it might be a good time to think about going back to that source. So I mentioned that I was a bit surprised based on things like word of mouth, social media, and using employee referral programs, kind of seeing a decline as a recruitment source. And this is really why. So if we look at the turnover rates and the acquisition rates, acquisition costs between the various referrals or recruitment sources, we see that Indeed, specifically looking at that deep purple bar, it's got the highest turnover rate. It's at an 84% turnover rate. It has a $561 cost of acquisition. And so we're spending all of our time and effort on Indeed as a recruitment source, but we're not seeing that payout in value over the long term. So essentially, every 10 caregivers that you hire through Indeed, 8 of them are leaving. And so if you take, just to make it easy math, 500 being spent per caregiver and 8 of them leave, that's $4,000 in sunk cost of acquisition costs to recruit from Indeed on caregivers that are ultimately going to leave our business. But if we look at things like social media, employee referral programs, and word of mouth referrals, those have historically lower turnover rates than other sources, and they also have a lower cost of acquisition. So if I'm thinking about this as an agency owner, I might say, hey, we need to do a better job with our employees, with building up a referral program. Maybe it's increasing the referral amount. Maybe there are things that we can do from a cultural perspective, like training, spending more time on training, focusing on different areas that will help us drive better outcomes through those recruitment sources and lower the expenditure that we have there, while increasing the number of caregivers who stay on board with us. And so speaking about turnover rate, just giving you a historical view over time, turnover rate has remained relatively flat. It's still hovering around 65%. So no surprise there. We're in an industry that has a larger turnover rate. And so, like I said, doing things to focus on keeping the employees that we have is really critical. And we'll touch on a few things that you can do in those areas to improve your turnover rate. So one big question that we always get is, am I paying enough? What are other people paying? So we've taken some data and looked at this historically over time, and we've seen some big jumps in pay for caregivers, for personal care. We've seen a jump over the past year of $1 to $2, essentially across the board. That's not surprising. We weren't dealing with inflation too much in 2021 when this report was pulling data, but we were dealing with things like the Great Resignation, and still dealing with issues of the pandemic impacting the number of caregivers who are willing to be vaccinated and work and provide data around it. So we've had to increase the pay there. On the in an alternative area, we're seeing more competition from organizations like Walmart, Amazon, and Target. They're competing for the same demographic that we are in the non-skilled caregiver area, and unfortunately those businesses are able to pay a bit more, and so that's probably influenced some upwards increase in pay as well. So we've got to do more to entice caregivers into this space, and that might be through things like upskilling on training, providing learning ladders that help them increase pay so that we can provide more specialized care. Might also be improving satisfaction by offering better benefits, or better alignment of schedules. So there's certainly a lot that we can do in those areas to help increase our retention rates without impacting our bottom line too much. And so another thing that we looked at was the benefits being provided to staff and caregivers, and we looked at that by revenue, by just different revenue groups. And so across the top, you'll see the revenue segments. So you've got your 0 to 799,000. At the far end, you've got the masters. Name is really just focused on doing 5 million plus in revenue, but travel reimbursement, PTO, and health insurance remain the top 3 benefits across the board. Interestingly, though, if we look at the top 3 benefits that the master segment are offering, they're offering healthcare, dental, and daily and weekly pay. And so one thing to think about is, number one, what are people in the larger revenue groups doing differently that we can maybe do? And also, what are competitors who compete in a space for our caregivers doing? So if you think about Amazon, Target, and Walmart, they're able to offer healthcare, dental. It's a major reason why they're enticing people away from this market, not just for hourly pay, but the benefits are substantially better in some cases too. And so we've got to do more to provide similar lookalike benefits in this space compared to Walmart, Amazon, and Target. It's a little bit more difficult for us because those organizations have such a large employee pool that they can subsidize the cost there. But in the very least, if we can offer some baseline of those benefits, it at least makes us competitive from a benefit perspective. Another thing that we're seeing more and more of that's really critical are letting caregivers get paid on a daily or weekly basis. If you're not doing that today, that's another critical thing to think about. Daily pay, if you think about the segment of the market that becomes a caregiver or is willing to work in that space, unfortunately, they're living paycheck to paycheck. They've got bills, especially now with inflation, that make it really challenging to go, 2 weeks without being paid. And so if you're able to pay on a daily basis, you help mitigate some of those risks around caregivers not being able to make ends meet between paychecks. Another thing that we're hearing in the market anecdotally, which I think would fall into that other category, if we look at that other category at the very bottom, it's comprising 14% of the benefits being offered. That kind of includes things like Netflix subscription, Disney Plus subscription. And so some organizations are getting creative with just different benefits around Netflix subscription and other things. Those might be low cost benefits that you can offer to employees that they will end up liking and will help with retention efforts as well. And like I said, if you have questions along the way, by all means, please let us know. I'm happy to answer questions. Chris, if you have any that pop up as well, by all means, feel free to stop me. But we'll dig into training now as well. Looks like we might have a chat came through. I can share the slides. Yes, I'll send those over to Chris, and he can share them with you as well. So if we look at training, sorry, I got sidetracked on my presentation here. So we've looked at the historical trend of caregiver complaints over the past 3 years. And so if you look at that, we've seen roughly the same 5 complaints from caregivers. And they just kind of switch positions for the most part within the top 5 year over year. But we've seen training grow in importance, and it's moved to number 1 in the prior year. And so clients, if we think about this, it's not surprising because clients are requiring more complex care, and the more that we can do to train our caregivers to provide specialized care, the more successful they'll be in their positions, the more likely they'll have clients that enjoy working with them. They're not complaining so much to them when they're on site. They're more likely to stay, and training in and of itself gives them an opportunity to also look at career progression ladders as well. And so not surprising that we're seeing training become a primary complaint from caregivers. We're also seeing pay have a slow trend upwards. It's now moved into the number 3 position. Well, I would expect when we run this survey again at the end of this year, we'll probably see pay trend up a bit more, might make its way to number 2 or even number 1. And that's mostly, of course, due to inflation. So we also looked at, okay, well, from a training perspective, how much training are our agencies providing to their caregivers? And so looking at this chart here, what we're showing you is at the 95th percentile of training. This isn't saying 95th percentile of revenue or size or anything. It's more looking at, how much training are you providing? And based on the answers that people give, that's how we classify on this chart for which percentile they enter. But if you look at the median, we're seeing on average organizations are giving 5 hours of orientation training and 8 hours of ongoing training. And so when we took that a step further and we kind of analyzed training numbers against revenue performance. And so what we found was quite surprising. Agencies that are offering 12 hours of ongoing training are making 20% more in annual revenue than agencies offering 4 or fewer hours. So if you're finding yourself kind of at that median of doing 5 hours of orientation training and 8 hours of ongoing training, speaking back to the caregiver complaints and back to caregiver and client retention, more training is better. There's certainly a threshold there, right? Like you can't have caregivers spending all of their time doing training. But as far as we're concerned, the data shows that 8 hours of orientation training and 12 hours of ongoing training are lending themselves to higher satisfaction, better retention, and more revenue. So one thing that we also looked at is, what type of training are you offering? Are you offering specialty-based training? And if so, which types of specialty-based training are important to you in delivering to your caregivers? And so 82% of our survey respondents said they're offering specialty-based training. And when we look at that further and we drill into what types of training they're offering, the majority are offering Alzheimer's training and dementia training. So if you're doing that today, great. That's certainly a key focus, I think, in this industry, is to be able to serve that market. If you're not doing that yet today, that might be something that you look into providing, whether it be in-house or through using a service like Home Care Pulse. And I can give you a little bit of information about that at the end here. And so finally, we'll jump into growth rates and finances. And so looking at data in this space, we're seeing growth rates climb back up to pre-2018 rates. They're rising by 2.3% after a 4-year decline. And so things are leveling out there. I anticipate that we'll continue to see client growth rates rise. We've seen, just looking at the broader industry, we've got a graying society. More and more people are requiring care. We've also got more people wanting to receive care at home. They don't want to go into a skilled nursing facility, especially after the pandemic. And so we're seeing an influx back into home care. And more particularly, I would say, with respect to this, we should see more and more clients come into this space through relationships with health systems, referral partners, and hospitals. There's something to be said for agencies who are taking data and going to the health systems and the hospitals and saying, hey, if you're discharging patients who don't require skilled care, we're a great partner for you. If you think about the hospitals, they're focused on reducing readmission rates, they're focused on quality. And so if it means discharging a patient into skilled care, that's certainly what they're going to do if it's required. But on the flip side, they might be discharging patients who don't require any care, but who might benefit from non-skilled care, because maybe those patients have a tough time getting up the stairs or bathing and they're slipping in the shower or having a tough time in the kitchen. And so if you can present yourself as an agency who helps reduce hospital readmit rates in the non-skilled segment, you have an opportunity to build a better partnership with those types of organizations. And so one thing that we've been consistently asking agencies is, have you been turning away cases? And so when I deliver this presentation in person, I typically ask at this point, how many people have experienced having to turn away a case in the past month or the past quarter. And I would say most everybody is raising their hands. Our data is suggesting that 85% are turning away cases in 2021. And then as far as people turning away cases consistently, 60% are suggesting that they're turning away cases consistently. And one thing I like to touch on after we cover that is, well, are you aware of how much it's costing your business? Because most people aren't taking the time to look into this. And so one easy way to calculate this is to, determine what your average case length is in either weeks or months, determine what your average hourly bill rate is, and determine what your normal number of hours per case might be on a weekly basis. And if you can extrapolate out, hey, I turned away 4 cases. On average, our case length is 1 year, 52 weeks. We bill $23 an hour, and our number of hours per case is about 10 hours a week. Well, then we're able to figure out, okay, for those 4 cases that we turned away last month, we just turned away $47,000 in revenue. So that's something to think about is, if you can figure out on average what a case is costing you to turn away, it's probably somewhere around $12,000, depending on what your metrics are. That's money where it's like, hey, maybe I should increase $1 in pay, or maybe I need to go out and hire a new caregiver, even though I can't give them top of licensure. You've got to find ways to be able to staff these cases so that you're not missing out on that revenue, because that revenue is essentially what's going to help you grow your business, increase your pay rates, and increase the likelihood that you can hire from word of mouth referrals and other types of sources too. We've also seen median revenue continue to grow. So despite ongoing challenges, it's actually grown 7.1% in the past 4 years. There's something to be said about, okay, well, there might be some, segmentation in the market that's leading to mergers and acquisitions. And so we're seeing fewer small agencies that have lower revenue, and we're seeing those agencies get gobbled up by larger agencies. And so top line revenue for the larger agencies is going up, and we're seeing less revenue at the smaller agency level because of just attrition in the space. And so that number might be getting pulled up through mergers and acquisitions. And so that's another thing about agencies. I'm not sure if you have an exit strategy or if you're in this for the long haul, but really getting deliberate and focusing on improving, culture, improving quality-based outcomes as much as you can will help you, number one, recruit more clients, more caregivers, but also make you out to be a more appetizing acquisition for a larger organization if that's of interest to you as well. And so we also looked at agencies that have been in business, how long they've been in business, and what their annual revenue is. And so, we're seeing that the businesses that have been in this space for 7 to 9 years are averaging about $2 million in annual revenue. Those in business for 10 plus years are averaging about 2.7 million. So this is just nice for you to look at to kind of compare. Okay, I've been in business for 2 years. I'm doing 1 million in revenue. Maybe you're doing 1.5, and that gives you some insight as to, okay, I'm behind where the average is. What do I need to do to make improvements to reach that average or even exceed it? So we also looked at how much agencies are spending, and this is probably more impactful to you on a day-to-day is, if you find yourself in one of these revenue groups, are you spending about the same in sales and marketing expenses? Sales and marketing expenses could be tied to, Google AdWords or Indeed, paying Indeed for new caregivers, advertising that you're throwing out there. And so, you might have some opportunity to reduce some expense if you can focus on some of those lower cost of acquisition, recruitment sources like word of mouth or social media, or employee referral bonuses. And so if you're trying to pull that number down, you might focus less on certain areas and like Indeed, maybe focus more on some of those other ones that I just mentioned. But this just gives you some insight into where most organizations are spending their money in sales and marketing. And we also took a look at just historical payer sources. And so we've seen private pay decline slightly over the past year. But if you look in there, we've also seen things like the VA programs increase. So it's increased from 3.6 to 6.1. So it's doubled over the past 3 years. So if you're not playing in that space, maybe that lends itself to, hey, we've got to do more with the VA. We've got to do more to bill Medicaid directly. I think over time we're going to see increases in Medicaid, MCOs, and ACOs. I'm of the belief that, I kind of gave that example of getting close to health systems and hospitals. I'm of the belief that the more you can do to buddy up with those types of organizations now, the better off you'll be long term. And the reason for that is we're on a trajectory right now that's unsustainable. We don't have enough caregivers. We can only increase pay rates so much. We can only increase bill rates so much. We can't do it alone solely on the backs of private pay. And so what major health systems and hospitals are likely going to find, if you can tell the right compelling message, those organizations are focused on value-based care and quality. They're focused on reducing hospital readmission rates. And so as they continue over the past 10 years of working in this industry, I've seen those health systems grow significantly. They've acquired all of these ambulatory practices. They've acquired hospitals. They've acquired, outpatient surgery centers. They've acquired home health and hospice. But one thing that they haven't, that they're just kind of starting to really get into, is into home care. And the major reason for that is they've kind of tapped the market in those other spaces. They can't generate higher profit margins, so to speak, from them anymore because they're already part of the ecosystem. They're already operating on the quality processes that the hospital and the health systems want to operate on. And so there's less juice to squeeze in those areas, so to say, or so to say. But the one thing that they can do is partner with home care or acquire home care and say, hey, we don't need to discharge all of these patients to home health. We can discharge 40% of them to home care, and we can do it at a fraction of the cost, and we can reduce our hospital readmit rates significantly. And so that's where we should be spending our money. And you'll have a bargaining chip then to say, hey, we'd love to do it, but we can't do it just solely through private pay. You've got to shoulder some of the expense, whether that's, I live in Pittsburgh, and we've got UPMC health system here. UPMC also has its own health plan. And so if we think about something like UPMC as a home care agency, we could go and argue with them and say, hey, we want to partner with you. We can deliver all of these great outcomes, but you need to write in some benefits to share the responsibility for paying the bill rate that we have. Because if you're billing let's just say you're billing your client $23, you can only pay your caregiver $14. Well, if the hospital or the health system or the health plan takes 50% of the patient responsibility, well, then you can increase your bill rate to 30 or 40. And then you could pay your caregiver $18 an hour. And now you're competing at a similar pay rate with Amazon, Walmart, and Target. And so I'm of the belief long term, that's how this industry is going to change. Unfortunately, it looks like there's some policy that's reducing budgets in this area right now, which is unfortunate. We're taking a little bit of a step back. But I think as the data becomes more formal and sophisticated in this industry, the more likely we can make a case that we need to be part of that picture. And so what's next for the industry? I think it's what I just mentioned around getting closer with hospitals and health systems and being more focused on capturing data that tells that compelling story. That data that you capture also gives you an opportunity to go to new caregivers and say that you're the best place for them to work. It gives you data to go to clients and say, hey, you're the best. We're the best place for client care. We have the best outcomes, and so that helps deliver better growth. There's also some technology changes happening in the space with just remote patient monitoring, things like that. And so we certainly see technology playing a vital role in improving and streamlining care as well. The caregiver shortage is not going to get better anytime soon. We need some significant changes in this industry for that to happen. So the more that you can do to focus on caregiver retention and recruitment, to beat out, your competitors, so to speak, the better off you'll be. And as far as back to data, we have to use data for decision making. So we've got to be able to pull data and identify key business objectives. We've got to be able to explore and review the data with your team to help drive, small incremental improvements across the board. That data also gives you the ability to establish individual and team KPIs. So you might establish KPIs for your caregivers, for your schedulers, for your administrative team, for your marketers. So a number of different things that you can look at across the board. And data also, as if you take data and empower it from something like the benchmarking study, or you use other home care pulse services or anybody else in the market, you should have an opportunity to compare your agency against others in your region, the population size and revenue range that you fall within. And then last but not least, we've got to spend time looking at the data to identify what larger agencies are doing differently that we can then implement at our organization to help us grow and meet demand, and catch up with the bigger players in the space. And so just as a summary, we don't see the caregiver shortage getting worse. Caregiver turnovers remained relatively stable, so we've got to do better there to help reduce that rate as much as we can on an individual level. Indeed's helping agencies hire the most caregiver, but it's also yielding the highest turnover rate. So we might need to invest time in other recruitment sources. Agencies that are delivering more than 12 hours of training are generating 20% more in annual revenue. So if training is not central to your business, it certainly should become central to it. There's this big pervasiveness in this industry that, we're afraid to train caregivers because they might leave. But the truth of the matter is, what happens if we don't train them and they stay? That yields a worse client experience, and that helps. That doesn't help anybody. It actually reduces our effectiveness in the industry, and it lowers our ability to cater to our clients and take advantage of increasing client growth rates. So speaking about client growth rates, they're up 2.3%, and median revenue is up 2.4% from 2020. And then finally, the industry is evolving, and you need to adapt your business to prepare for those upcoming trends that I had previously mentioned. And so, and Chris, by all means, feel free to jump in here too, as well. But SwiftOps does a tremendous job for you. They're a great partner for Home Care Pulse as well. And if you're not familiar, Home Care Pulse is integrated with SwiftOps to help you overcome a lot of these challenges and give you data that empowers you on a day-to-day basis. We're really critically focusing on what matters most, which is becoming the best employer and provider in your area. So we have an integration with SwiftOps. That integration allows you to leverage our training capabilities as well as our experience management platform. It's automatic. Your rosters stay up to date in our system. Doesn't require any manual effort from you. We seamlessly capture client and caregiver feedback to improve retention efforts, and also focus on just different data elements that you can make improvements to on a month-to-month basis. And all of that helps you spend less time on data entry as well. Chris, anything you would add?
I think you did a great job. I appreciate it. That did cover what I would have said. If you are interested in talking to Home Care Pulse, please make sure that you go through the knowledge base. Just search the word Home Care Pulse. The article will come up. There's a link inside of there which will bring up a landing page. You can put your information in there, and it'll go directly to Home Care Pulse. They'll know you're a SwiftOps subscriber. They'll be able to talk to you specifically about the integration and the different things that we offer here that you could take advantage of. So if you call them directly, that's fine as well. But we want to make sure that going over there, you're able to let them know that you're coming from SwiftOps, and that's the easiest way. But the e-learning, the surveys, all that's available for you now. It's already out. It's been there, and we've got a number of folks taking advantage of it. Any
Great.
questions out there, whether through chat or come off mute about anything that you heard?
Yeah, and while people are unmuting, it looks like there's a couple questions in the chat box. So Stacy asked, is any of this data being shared with companies that pay for care, i.e. Medicaid, Medicare, insurance companies, so that they are aware of the challenges we are facing with recruitment, retention, and the like? State of Michigan is still paying $16 an hour reimbursement in some cases, and moving the needle has been impossible. So we do share quite a lot of our data with just a lot of different organizations in across the country, including state associations. And so we're doing our very best to share data with just different agencies who end up negotiating in various states. Unfortunately, a lot of what's going on, we just need to get more data in their hands, and that starts really at the agency level. So the more and more data that you can capture that tells that story and share it with, your state associations or with SwiftOps or with Home Care Pulse, so that we can build these bigger cases for increasing reimbursement rates and building better partnerships. We're doing it today, but it's an uphill battle for sure. So I'm with you there, Stacy. And then Obioma had asked, can you please explain the integration process? Who can we speak to regarding the integration? So Obioma.
Yeah, I shot her the link.
Okay, perfect.
Yeah, just click the link and all the information's there about the integration. It's an API integration. Depending, it says you have the e-learning. There's a process for you if you're a current subscriber to Home Care Pulse, as well as if you were new. So you just want to make sure you follow the right one. But yep, and then reach out to support, either SwiftOps support if you needed us to guide you anymore. We'd be happy to do that as well. And then I think I saw Loretta had asked if we're going to provide this recording. We will. As soon as this is done, I'll process it and get it all set up as a viewable YouTube link, and I'll get that out to everybody. And it looks like we have another question though from Marissa. Josh, talking to Stacy. Oregon State Association has worked hard to lobby our state legislative body, and our rates have increased now over $36 an hour. Thanks for sharing that.
Yeah, that's great. So just what, and we still have time if anybody else wants to unmute, but I'll go through a couple more things here. Just a reminder, benchmarking report is available. If you've not accessed it yet, you can at homecarepulse.com/benchmarking. And then finally, just touching base on what Home Care Pulse does. We really believe that this industry requires consistent and regular focus and improvement. And so what we've built is the first care intelligence platform. And so what I like to do is just explain to people what that consists of. So we really view 3 important elements as central to improving your business over time. Number 1, it's listening to people, listening to caregivers, listening to clients. Number 2, it's empowering them. And number 3, it's asking for their support. And so what that ultimately looks like in Home Care Pulse is our experience management survey and reporting gives you an opportunity to learn the good, bad, and ugly about your business and then take action. On a month-to-month basis, we go out, we survey your clients and your caregivers, and we give you critical feedback on key areas for improvement. They're telephonic surveys, which actually is very good for this industry. Things like digital surveys don't always work out all that well because of the demographics that we're dealing with. So we make calls on your behalf. We give inform letters that you give to your clients and your caregivers that let them know, hey, Home Care Pulse is going to call you and they're going to call from this number. We're focused on consistent improvement. So that's why we've empowered Home Care Pulse to work with us. So we give you an opportunity to listen to your clients and caregivers and uncover areas of improvement. Once you've uncovered those areas of improvement, like let's, for example, say a client said to you that they really wish that their caregiver could do a better job around the kitchen, that they need more help cooking breakfast, or help with bathing tips, you can then come back into Home Care Pulse into our training platform, and you can assign those types of courses to your caregivers. So we've actually got a library of over 450 courses. We don't gate any of our content. Our content meets the continuing education requirements in most all states in the country. So if you're focused on, the 12 ongoing credits that you need for caregivers, that's something that we can help you administer. We have it through our virtual training platform that's available on the web or through our application for Android and iPhone. So it's very easy to ensure that your caregivers are staying trained. And then, when we talk about specialty care programs and training verticals, that's something that we help with as well. And so we don't gate any of our content. So when you subscribe, you get access to everything in our library. And then finally, once you've surveyed those people and you've kind of prescribed some sort of medicine, whether it be training or better scheduling or daily pay, you can then go back out to your clients who are now having a better experience and use reputation management to ask them for a review on Google or Facebook or Yelp, somewhere else. And that system helps you build brand awareness and reputation online, so that when people are searching for home care in your agency, you're the first one that pops up. And so that's really it about our platform, but just wanted to be sure everybody is aware of what we can help you accomplish. All of those things help you improve on all of the different metrics that we were looking at, as far as cost of acquisition, retention efforts, reducing turnover, increasing client lifetime value. That's everything that we're centrally focused on for your agency.
All right. Thank you, Josh. Is there anything else? Anyone else have any questions? Want to come off mute? Throw it in the chat. Last chance. All right. Fantastic. Well, Josh, we appreciate the time. Thanks for sharing this with our subscribers. I will get this recording ready and get it out. And if there's anything else, just reach out to support. We can guide you as needed. Oh, wait, there is a question. Hang on one second there, Josh. Does the reputation management platform support clients facing technology challenges? No cell phones or emails.
So it is more geared towards capturing reviews via a text message or an email. But to your question, Obioma, our experience management platform, the ability to survey. So one thing that's unique about that platform is that when we survey clients over the phone, if they leave a really positive score, we actually have the ability to push those reviews over to caring.com or bestofhomecare.com. And so if you're looking to build reputation digitally, you have an ability to do it through our experience management platform after we capture the telephonic surveys. And that doesn't require them to go out and enter anything. We push those reviews directly over to those sources. So hopefully that answers your question.
All right. I believe that should do it. Appreciate it, everyone. Have a great rest of your week. And again, Josh, we appreciate the time. Thanks, everyone.
All right. Thank you.
Bye-bye.
Bye-bye.